from Kalispell, Montana. He is a compounding pharmacist in Kalispell with Evergreen Compounding Pharmacy. Harley is going to be on the phone with us today. Harley, welcome to our show. How are you?
I'm doing well. Thanks for having me, Sean. How about yourself?
I am doing great. Thanks for calling in and being with us on our show today, Harley. So we're going to start and just jump right in. A little bit about your background, Harley.
Perfect. Well, so I've been a pharmacist, nearly 20 years, and kind of similar to you and Janet, my wife is a pharmacist as well. She's got a year on me, so if I can't figure something out, I always go to her. It's
Well,
good.
hey, my wife has almost 4 years on me.
Yeah. So yeah, basically, my experience has been pretty well rooted in hospital. Got some retail experience. Spent a few years working for health insurance industry, and then just late last year, Aaron and I decided to go and get into compounding. We see a lot of tremendous opportunity in the field, and it really excites us. So
That's wonderful to hear. So we'll get into that a little bit later about compounding and kind of define what it is, and you can educate us on that. So let's start with a little bit about your history. You said you worked for an insurance company, so tell me a little bit about that.
sure. So coming right out of school, I spent a couple years there in Moses Lake working for the hospital, and then took a jump, went down to the Las Vegas market, and boy, big population difference, but a lot different opportunity down there in the time. That was right around 2004, 5, and 6, when we got the Medicare Part D programs that were being launched. So I went down to Las Vegas to work ambulatory care, which for people, there are pharmacists that work in clinics that work side by side with nurses and doctors and kind of help pick therapies and do education, and that was really my role. When Medicare Part D came out, I was pulled to the corporate office for an insurance company there and started to run the benefits for the commercial lines. And then Erin, my wife, went down as well, and she ended up doing the Medicare lines. So it was very eye opening to see how the insurance industry worked, what the definition of a benefit is, how therapies are decided, how costs are decided. So my role, pretty much as the commercial lines, is I would work with large employer groups, and I would meet with their administrators, and they would say, hey, we need to create a pharmacy benefit for our patient or for our employees. So show us how a generic copay comes about, and a brand name copay, and what does non-formulary mean. And so I learned a lot of terms that then Medicare adopted. And so Aaron took that lines up, which is kind of a different beast, but at the time, Medicare kind of followed the commercial industry, insurance industry, and now about 15 years later, we've kind of seen an about face, and now all the commercial follow what the government says we should do, in a sense. Does that help a little bit?
Absolutely, absolutely. So what are you saying when you say generic copay versus brand copay? Tell me a little bit about that and how a consumer would or benefit from that when you saw the inside.
So when I saw the inside, typically, in a free market, a health insurance company is there to, uh, report to their shareholders to make money and remain viable, right? So when we would get new products that would come to the market, typically new products that come that are brand name are extremely expensive, and so we would determine which product in a class of 5 different medications we would cover for, for just say example, $20 or something for a 30-day supply. Well, there's 5 different competing drugs out there, and for an entire population, not all 5, or not just one of those 5, isn't necessarily best for the entire insured population. So what you find in that type of a setting is you see circles trying to be put where squares are, because not every person, I would even argue probably nearly 60 to 75% doesn't always fit that circle or square. So in the end, some people benefit tremendously, but most typically don't. And by creating middlemen in the middle with a person to process a claim, us to set the benefit, the insurance company and the employer not wanting to lose money, so to speak, and cost money, by the time it finally gets to the consumer, you've got so many layers of hands in the pie that the consumer spends quite a bit more than if you removed all of those.
So what you're telling me is a lot of times health insurance, or most times the health insurance company does really not give the patient the best drug. They give them the drug that's going to cost them the least. Is that what you're saying?
Absolutely. In general, yes. And, you know, many of the studies that come out where you evaluate these therapies it's very difficult to do apples to apples and oranges to oranges. So ultimately what it boils down to is you know, typically a fiscally viable approach for an insurance company.
Okay, so you talk about brand names, and I know typically those are pretty expensive. So a patient will pay whatever their copay is, a percentage or a set dollar fee. What about generics? What is your experience with in the health insurance industry with generic drugs and insurance companies paying for them?
So in general, prior to Medicare Part D, it pretty well covered. Generic drugs were pretty inexpensive. However, there's a certain amount of drugs that fallouts that are generic drugs that are on the market that haven't gone through FDA approval, that are called DESI drugs, and insurance companies in general, as we followed more and more Medicare guidelines that say this is safe and effective, we've seen generic cost of medications go through the roof. And so now more and more insurance companies are putting those at higher tiered pricing. They're not giving access. They're passing on the price of that to the consumer. So I've seen the cost of generics really in the last 10 years significantly increase in price and access. And I think a lot of that has to do with, following guidelines that aren't necessarily always proven, I guess, for lack of a better way.
Now, is it true in your experience that a lot of times the patient would be better not running the generic prescription through their insurance and just paying cash out of pocket and getting a 3-month supply instead of a 30-day supply like the insurance only allows?
Yeah, absolutely, absolutely. If you can work with an independent pharmacy or someone who, can obtain those drugs less expensive, and you don't bring that third-party middleman in, then consumers can buy them for reasonable price. Absolutely, and I encourage that every step of the way.
See, a lot of patients don't realize that many times they think they're getting this big benefit that they call a benefit through their insurance, but a lot of times if they do their own shopping, whether it be medications or whether it be surgery or whether it be a doctor's visit, they can pay out of pocket, and it'll be less of an expense than it would if they were paying their insurance copay.
A great example, because let's talk about EpiPen real quick. The price of EpiPen has skyrocketed, and in the state of Colorado, they cover the brand new EpiPen on most insurance plans that talks to you and tells you what to do, and it costs like $5,000. Well, insurance will pay $5,000 of that, and the patient may have to spend a couple $1,000. Well, we just went online, looked up on, I think it was GoodRx, and found that you could get a Walmart coupon for 2 EpiPens if you presented it for like $110. And I mean, that's still an expensive medication, but you can see the difference in the delta and the price that ultimately the consumer ends up paying for the same medication that will save their life.
It's incredible, and I think as healthcare providers, we need to do a better job of letting patients know about that and how a free market can help save them money. So speaking of Medicare Part D, you talked about Medicare Part D. Now, were you in the industry at all before Medicare Part D?
Yes, I was in the industry about a year prior to Medicare Part D.
Okay, so let me just educate our listeners a little bit on what Medicare Part D is. So Medicare Part D is prescription drug coverage. And up until, help me with the year, Harley, up until 2000, when did your Medicare Part D come into effect?
2005.
2005, Medicare Part D came into effect. Up until before then, Medicare was enacted in 1964, and there was no prescription drug coverage. It was seniors had to pay out of pocket for medications. Now, I will tell you, I graduated from pharmacy school in 1994, and until 2005, I experienced where, a lot of Medicare patients did not have drug coverage. Now, here's what's really interesting. When I first got out of school and before 2005, the average price of a drug was like $28. Um, the year Medicare Part D passed, the prescription drug prices went up 18%. And now I think an average prescription drug price is over $200, which just tells you when there's no free market and there's no cash only consumer anymore, when the seniors were taken out of the cash market, pharmacies, drug companies would raise their prices, pharmacies would raise their prices, and because somebody else was paying the bill, the consumer wasn't anymore. So the prices did not have to be competitive. So it's interesting how when a big government program comes into play, I think people need to realize that that is what makes healthcare expensive. That is not what makes healthcare less expensive. It's what makes healthcare expensive. And we can share a lot of numbers like that. In my book, I write about that. The price of nursing homes and hospital visits after 1964, when Medicare was passed, went up substantially. And of course they did, because hospitals and nursing homes didn't have to be competitive on pricing anymore. So because Medicare is paying the bill. So we need to really let consumers know that, and that there is a way around that. You can still shop with your feet and work in the free market.
Absolutely, and by definition, anytime a government program is involved, it's a third party purchase, and we can get about first party, second party, third party purchases, and really what it ultimately ends up being is the person who is using the product doesn't have any skin in the game, and when that happens, prices go through the roof, quality drops, and you're kind of left with a expensive, poor quality product. And
Absolutely.
that's the exact opposite of what free market stands for and what we as professionals want to provide for people.
That's right. That's right. And we do need to realize that there still is a free market. Patients just need to find that, and we as healthcare providers should help them.
Absolutely.
So tell me a little bit. You mentioned you were in a hospital for a while before you opened the compounding pharmacy. You were kind of involved in benefits with them too. Is that correct?
Absolutely, yeah. We're a self-insured hospital, and as costs have continued to rise, the hospitals are always looking at ways to try to save, and so one of their targets is to acquire physician clinics, to acquire pharmacies, because that's in a huge expense when an when an employer, so it's just the opposite side of the ball that I was on in the insurance industry. Now I'm on the other side as representing an employer trying to work with a third-party insurance company to bring benefits in-house, so then we're paying ourselves. And in that there's lots of different areas that nonprofits benefit, and how the structures are designed. Again, don't point to every consumer that they're servicing. Yeah, they provide benefits, and when I say benefits, I use that term loosely because most plans now have high deductibles or high premiums. It's extremely difficult to afford, and so what they do is they eliminate choice. They push you to a physician that they want you to see, or a pharmacy that they want you to go to. So they eliminate the choice, which again then decreases the free market choice, and then you are, quote, stuck with a service that you're getting or not getting.
So an employer basically is directing where their beneficiaries can go to a doctor or a hospital, correct?
Absolutely, they remove the choice.
Right.
Yep.
And
Yep.
I don't think most people really like not having a choice, and realize, people, that you have power. It is you that is in control. You can negotiate these things. So do not be a slave to some insurance through your employer and not be able to go to the doctor or the hospital that you want to go to. So it is about that time for a break. So we are live on KBS 70 AM Moses Lake. We will be back shortly. Thank you.
This fall, Visa Credit Union is offering a certificate special to be thankful for.
So, I don't.
It's recording, but it's not streaming. Is it streaming on Facebook? Or is it
Yeah,
not?
it is.
Well, but is it streaming? It's locked up.
Yeah.
Okay, why is that on my face? That shouldn't be on my face.
We at Shiloh Inns are proud to be celebrating more than 44 years of providing you, our loyal customers, with Shiloh's sincere friendliness, efficient customer service, and clean, comfortable, attractive, non-smoking rooms and suites, all at an affordable price. Hello, I'm Mark Hemstreet, owner of Shiloh Inns. Our customers love our many free amenities like free Wi-Fi and free continental breakfast or delicious breakfast at most Shiloh Inns, as well as our spa, steam, sauna
Is it still
rooms,
locked up?
exercise fitness facilities, and business centers. And at Shiloh Inns, even the kids stay free. And for you dog lovers, Shiloh is very dog friendly. If you ask your best friend where they want to stay, we think you'll get a paws up for Shiloh Inns. For reservations, call 800-222-2244 or visit our website at shilohinns.com. Shiloh Inns, affordable excellence. American family owned and proud of it.
Our goal at Confluence Health Gastroenterology is to provide you with the highest quality care in the country, close to home. Whether you have heartburn, liver disease, or just need a colonoscopy screening, our team of 9 highly trained and experienced gastroenterologists are dedicated to addressing your individual needs. Our physicians trained at top-notch fellowships from across the nation.
Make sure that lights. That's the most important part.
University of Washington, University of Michigan, Northwestern,
If the camera looks up again, just goes over it. It's going to audio.
the genuine and hardworking people of Central Washington and are dedicated to keeping you healthy. When you have GI-related issues, know that the team is trained to you bracers and devoted to serving our community. At Confluence Health Gastroenterology, we will treat you like the good neighbors you are. Call us today at 509-764-6400 to schedule an appointment, or visit us at confluencehealth.org.
Jim Bohannon here, reminding you to listen to my show weeknights at 8 on AM 1470 KBSN. The Jim Bohannon Show is actually 3 shows in 1. The guests range from people in politics, entertainment, sports. Who knows who I might talk to next? You conduct the interview with your questions as well. Then it's open phones, just you and me talking about whatever you like. The Jim Bohannon Show is part of the nighttime talk lineup on your first choice for news and information, AM 1470 KBSN.
Hello, listeners. Welcome back to Health Solutions with Sean and Janet Needham. It is Monday, and every Monday, listen to us here at 1 to 2 p.m. We have Harley Brotherton on the phone with us today. Open phone lines, 509-765-1470. Harley, let's get back into our discussion. You were talking about a compounding pharmacy. Tell me a little bit about that.
Compounding pharmacy is a pharmacy that specializes in therapies that you can't get traditionally. For instance, we make custom medications for animals. We make topical creams. We make lollipops. We make sublingual troches. Tons of different hypoallergenic products for people that otherwise can't be served by a traditional pharmacy or big pharma.
So you're telling me a compounding pharmacist does more than just count pills and bill insurance companies?
Absolutely. Compounding pharmacy is exciting, it's fun, it's challenging. It's kind of like the old apothecaries back in the early 1900s where you'd come in and there was a gentleman or a gal back behind the counter, using their brain, coming up with something that was unique for you, and take a lot of pride in what we provide, and know that it's customized therapy for that individual, one-on-one.
Well, as you know, Jan and I have a compounding pharmacy also, and we believe in it. We have a passion for it. I teach the advanced compounding course at the University of Washington, Pharmacy 525, and one thing I tell the students, and I tell everybody this about compounding, I believe compounding is the past, present, and future of pharmacy. It's something that pharmacists have done for years, thousands of years. In the 1950s, we largely gave that up to drug companies and let them make everything. But there's a resurgence of it because drug companies cannot meet the individual needs of every patient for sure. So tell me a little bit about veterinary compounding. Why would you have to make something for an animal?
Well, I would say the bulk of our vet compounding that we do is for small animals. And tend to be affected with seizures, and we use different salt forms that we make in suspensions or capsules. The beautiful thing is we can flavor those with grilled beef flavor or roasted chicken. We just do some really creative things for animals, for the dogs. Cats tend to, for some reason, at least where I'm at, have a lot of thyroid problems. So we do this anti-thyroid or a thyroid medication that we, again, can do in a tuna-flavored suspension, or we do it in a little cream where we can rub it in their ear to help them absorb it. So, those are two really common. We've done prescriptions for ferrets. We've done prescriptions for toucans, toucan birds that pick themselves, and so we give them behavioral modifying medications that taste like oranges or tutti frutti. So, people love their pets, and most people that come see us are excited to take care of their pets. It's by the time they get to us, they've typically tried other big, mass manufactured little pills that they had to go home and put in a pill cutter and cut it 16 different ways, and the poor animal's not getting the proper dose. So when we get them, then it's really a life-changing emotional experience. Same with equine. We do a lot of horse prescriptions for horses. So we really enjoy it, and it's a huge part of our compounding business, actually.
So toucans, ferrets, how cool is that? So veterinarians don't just call up your local. Yes, still here. Can you hear me, Harley?
Oh, yep, I can hear you.
Okay. So toucans, ferrets, how cool is that? These veterinarians don't just call your local chain pharmacist and ask them to make up something for a toucan. They'd give you like the deer in the headlight look, right?
Yep.
So tell me about, what did you do for a toucan, and how was the owner, how appreciative was the owner?
Well, so the vet called and said, hey, we have this 3-year-old toucan who is plucking all of its feathers out, and it's riddled with anxiety. And the owner had moved from, a warmer climate to Montana, where we're getting snow today, by the way. So, and the vet said, hey, we need to give this toucan some Benadryl or some clomipramine to help behavioral modification. So we called the owner, and they said, okay, what do you feed the bird? The owner was like, well, we feed bananas and we feed apples, and like, well, let's try an apple suspension that we could drop into these little individual syringes, and then we made it very, very concentrated, so it would just be 1/10 or 2/10 of a mil, which is a tiny amount of liquid that she literally just put into the beak of the bird. And after 5 doses, the owner called us back crying because the bird hadn't picked in 3 days, and now the bird sees it as a treat. And they've even come as far to bring the bird. We don't allow the animals in the pharmacy, but they'll bring them right out front to the window, and we'll go meet the bird. And it's just things that I never thought in 20 years of pharmacy I would be doing. And we've had that same owner bring in, they bring in gifts for us, like cookies at Christmas time, and you hear some of those old stories that people used to do to their pharmacies, and we have that here, and it feels very personal and very, it's just a warm environment, I guess.
That is so cool. I'm so happy for you, Harley, and so proud of you and your wife, what you guys are accomplishing. I know when I first met you, probably almost 20 years ago now, when I first met you, I knew that you were not a typical pharmacist, and I knew someday you would be an entrepreneur and working for yourself, because I could just tell that you were different. And it's been like we reconnected last year, and it was 15 years before that, but I knew there was something special in you, so I'm really happy for you.
Well, I appreciate that. And, you're part of that because, I saw what you were doing, and I watched it from afar, and I was a little slow on the uptake, but I'm where I belong now, and I love it. But just like you said, past, present, and future, the future of pharmacy is compounding, in my opinion.
That's awesome. And of course, I think we have to give a plug for our wives. Choosing our wives makes it kind of helps that whole situation.
Oh yeah, I absolutely could not do what I do here without her. She's the ultimate compliment to me, and I love her to death. So
Awesome. So veterinary stories. What about some other things? Why would somebody need a compounding pharmacist? Give us some other situations.
Sure. I would say another big one is hormone replacement therapy. There is no reason for women and men to live miserably. You know, as we age, our hormone production drops, and quality of life with that. So hormone replacement therapy is huge. That includes, thyroid, customized thyroid dosing. I mean, we get right down to 1/10 of a microgram. So we can dial that in for people. A lot of commercially available products have lactose in them or other fillers that people just don't do well with. So we provide that as an alternative. People that have difficulty swallowing, like I mentioned, we do sublingual drops or sublingual troches, we call them, that just go under your tongue and dissolve. So, people with swallowing problems. I kind of mentioned lollipops after surgery for people, or topical pain creams. If you want to take a pain medication that's not an opiate, you can get really bad knee pain. We make a great knee pain formulation you rub on your knee, and you don't get all the side effects from all the oral capsules. So there's some other really great opportunities, and really the sky's the limit. We're always looking at new ways to formulate something, or a new dosage form, or a new way to penetrate something to make it work better with less side effects.
That's what I love about compounding is, we're able to use our chemistry background and, what we actually learned in school to make a good product. And I felt that I wasn't really, using all of the knowledge that I learned in pharmacy school when I was just counting pills and billing people's insurance. So I really feel that I get to make a difference in people's lives now with compounding because it's an individualized treatment.
And another piece to compounding that I like to plug too is, I think we all need to be lifelong learners. And when you get into most other fields of pharmacy, the way it's been designed the last 20 years, it gets to be a root behavior, and it gets to be mundane. You master something and you lose that hunger. But with compounding, it changes every year so much, and there's so much applicable knowledge. I mean, I find myself as a voracious reader when it comes to compounding, and it's like, wow, I never learned that about this, or this drug did X, Y, Z. So it instills that, which then we model for our kids, and we teach our next generation how to be lifelong learners. And I think that's so important for us.
Absolutely. We don't stop learning when we get out of school. I mean, really, honestly, it just starts, and that's how we're able to stay on top of things. So,
Yep.
So tell me a good patient story. You have a good patient story about hormone replacement?
Oh, absolutely. Boy, we had a gal come in I guess it took about 6 weeks ago. She came in and said, hey, I've been using this commercially available product, and it's extremely expensive. It's well over $300, and I just feel terrible, and I can't get my general practitioner to write for something different. There's got to be something better. And so I said, well, you might want to try this person and see if you can connect. So she got into a private individual, again, not affiliated with a private physician group, right? One person working on their own, not under a big blanket of an insurance company or another company. Got in, did some hormone testing, I talked with the provider one-on-one. She said, okay, here's where we're at. This patient's basically couldn't read her testosterone levels. Her estrogen levels were way out of whack. She couldn't sleep.
Wait.
Right?
So this is a woman?
This is a woman.
So you're telling me women have testosterone also? Is that what you're telling me?
Absolutely, they have testosterone.
Okay, just had to clarify that.
Yeah. Now, they don't have it in the same amounts we do, but just like us men have estrogen, and you see guys walking around with big bellies, they probably have estrogen imbalance.
Too much.
In general. But, so back to this gal. So they did all the testing. The provider and I talked on the phone, discussed her case, came up with a cream in a capsule that she started to apply every day. After 2 weeks, I guess it wasn't even 2 weeks, it was 10 days, she called me back and said, I haven't slept this well since my early 20s, and she's in her late 50s, early 60s, I believe, maybe 62. She goes, how come nobody told me about this? And she's a nurse, worked in the healthcare industry for over 30 years. And it just, that's another example of, she's like, thank you for getting me in touch with this provider. Thank you for not just, because I quote, struggled with the other standard providers she'd seen for the last 20 years, just getting a simple change for some basic female symptom relief. So when we dug deeper, it wasn't just about her female symptom relief, it was about just her overall health and levels. So when we addressed it from a holistic approach, so to speak, or an integrative approach, and we started therapy, like I said, 10, 14 days, you could tell she was on a path to wellness. And I mean, she still checks in and just asks tons of questions. I love that about her. She'll call in and say, well, I was reading this or reading that. It's created that in her as well. So it's so rewarding to get that phone call.
Yeah, I echo that. We get those calls almost every day, or a note of encouragement or a thank you. And, you know, you're changing lives, Harley. I mean, how special is that? How cool is that?
Absolutely. It really, it's a joy to come to work again. And it's a joy when I'm outside work, because I'm always thinking, well, how could I have done something better that I just did today? And in the past, I would just do something as it was and move on, and I never thought about it again. Where here, I'm always trying to think, what if I spun it for 50 more seconds, or what if I'd done it this way, or measured it that different? What would the outcome have changed to make it better?
That's wonderful. So, speaking of that, so it sounds like you work with an individual doctor and the patient and the pharmacist. There's just three people in that triad, right?
Absolutely.
Okay, so there's no insurance company involved?
No, heavens to Betsy, no.
Okay, so tell me a little bit about that.
Well, so we don't do any insurance billing. We can provide people what we call a claim form that they can track for their tax purposes, or they can work with their insurance company. We found that historically, coming from the industry and then reviewing this business that we purchased, that bringing that insurance in the middle of things, not only did they reject a lot of times, so it was kind of a lost cause to even try to get reimbursed, for one, but then two, all it did would drive up costs. So being on the other side of the coin with my insurance background, I would see pharmacies when the patient wasn't paying, I would see $500, $600, $700 claims. They'd ask for that amount of money on a product that I would usually and customary for $69. And when they pay that kind of thing, there was no inherent value brought to the patient, and it's not ethical in my opinion. So we only cash, we set the price, we set it at a point that's affordable for people, and we'll walk them through to help them any way we can.
That's awesome. I like to hear it. And you being inside the industry, the insurance industry, you definitely knew how, costs would get artificially inflated because there's so many people involved. So when it's just you and a patient involved, you can offer something better at a lower price.
Absolutely.
And not just something better, but something specifically for that patient, not something that the insurance company or that person's employer decided that was better.
Exactly. Yep, spot on.
So what is the average price? I know that's a very, very generic statement, but what would be the average price of a hormone replacement for 90 days at your pharmacy?
Well, for 90 days, if you did a full hormone replacement therapy for 90 days supply, it's under $100.
And you're talking about this gal that came into you, she was spending it would have been over $300 out of her pocket per month for her therapy, right?
Yep.
So you're saving her $900 every 3 months.
Correct.
And you're getting her something better.
That's how it works.
Amazing. I love it. I love it when free markets work like that, because that's how it works. And the doctor that she went to, I'm assuming, is the same way. It was between her and the doctor, not some insurance company, correct?
That is correct.
And she got better service that way and a better product.
Yep.
Awesome. I love it. And a lot of people don't realize that, but when they don't use their insurance, sometimes they get something better. And that's one of the reasons that we are talking to people like you, Harley, that are entrepreneurs and not being a slave to those insurance models, because that's kind of what it is. And I believe that healthcare professionals, in some ways, that are in that system, and that's one of the reasons I got out, was I felt like I was an accessory to the crime. Here I was in a system that I didn't really believe in and making things more expensive. So that's one of the reasons that I got out. All right, it is that time for another commercial break. You are with Sean and Janet Health Solutions, and we will be back shortly.
Introducing free-range checking from Leland
Back
Bank.
up again.
Inspired by a wayward hen named Matilda, our checking lets you roam without all the worry. You can travel up to 25,000 miles in any direction and still get your ATM
Academy annual auction on Saturday, November 2nd at 5 p.m. at the ATEC building at the Big Bend Community College. This year's theme is
If you ever set the stream
That's
yet.
Italian for Revive. The silent auction begins at
Just
5
put the
p.m.
logo on
dinner
there.
at 6:30, and then the live auction at 7:15. Get your table for 8 for just $400.
Can it still say it's
By calling
recording?
793-2370. That's 793-2370. Or stop by the Moses Lake Christian Academy at 1475 Nelson Road Northeast, number 8. It's going to be a spectacular time Saturday night, November 2nd at 10 Pin Tap House. This year's Halloween costume party starts at 9 and goes all night long. Dress in your best costume for the contest and win prizes. Music by DJ Julio and tons of free specials. This is a 21 and over event. So make your plans for the weekend after Halloween night for some scary good fun. Saturday night, November 2nd at 10 Pin Tap House in Moses Lake. 10 Pin Tap House, your entertainment target on Stratford Road.
Hello, this is Dave Haverlow, and I'm a longtime Grant County resident. I have personally witnessed frustration from law enforcement due to the inability to arrest offenders because of jail overcrowding. Victims in Grant County are being re-victimized because offenders are being released back onto the streets. With the passage of Proposition 1, Grant County will build a new jail, and police departments around the county will increase their staffing levels to help combat crime. Please vote yes on Proposition 1 on November 5th.
Paid for by the Committee for a Safer Grant County.
Hey, all you groovy goonies. The Othello Rodeo Association presents the Othello Straw Maze every Friday and Saturday night, including Halloween. $5 per person. 6 to 7 is non-scare time, but then at 7 p.m., we let the ghouls out to play. Just take Highway 17 to Othello and turn right on Bench Road and follow the signs. Come on, play. If you dare. Find us on Facebook, Othello Rodeo Association, or Othello Straw Maze.
Hello, and welcome back to Health Solutions with Sean and Janet Needham. We have Harley Brotherton on the line with us today. Harley, we're in our last segment now. So I got a question for you. We talked about your pharmacy a little bit. So what is the goal of your pharmacy in the future?
Well, the goal of our pharmacy is to continue to grow, we have a passion for education, I guess I would say. As we go down this journey, we're not getting any younger. The more we learn, the more we want to pass that on to people and just let everybody know that you always have a choice. And let people know what we do, what you do as a compounding pharmacy, to know that you don't have to settle for second best. You can always find the best care for the best price and really make a difference for people. Whether that's hormone replacement therapy or customized thyroid dosing or animals, it's just about education and letting people know their options.
So when we talk about hormones a little bit, I just want to let you know, and that's what our pharmacy really specializes in. We have a passion for helping patients balance their hormones, and we've been doing that for 20 plus years now. And we work with providers all over the Pacific Northwest. And Janet and I just have changed so many people's lives that we just love that topic. So if you don't mind, I'm going to go down that road a little bit, Harley.
Sure, absolutely.
So when you talk about hormone replacement for women, do you typically send them to a doctor that specializes in hormone replacement, or do you work with their primary care doctor, or how does that work?
In general, we refer them to a specialist, someone who's got advanced training, not only from typically an allopathic approach, which is your traditional doctor, but not always a naturopathic approach, but more of an integrative approach. We're very fortunate in where I live in Montana in the Flathead Valley that we've got a lot of naturopaths, we've got a lot of allopaths, but we've seen an uptick, and we've got some integrative medicine or functional medicine, if you will, type providers who've gone and done extra training on truly understanding how hormone replacement therapy works and how to optimize their health and their levels. And it starts with hormones, but it needs to be a broader approach. It's like what you promote is making better choices at the dinner table, getting up and moving. If you're not moving, you're dying, and really working with providers that see that whole systematic approach rather than just throw, for lack of a better word, medication at them or sit down and have that hard talk. You need to exercise 30 minutes a day and lose all this weight. Well, those don't approach. It's got to be a softer approach, and you got to get people feeling better first, so they can apply that mindset and that approach that physician or nurse practitioner or naturopath is applying. Does that make sense?
Oh, absolutely. Thanks for telling us about that. So, for our listeners, if you don't mind, let's go over some definitions. You talk about a naturopath. What is a naturopathic physician?
A naturopathic physician is ND is the term they're trained. They're trained more from, I don't know if Eastern medicine is the best way to talk about it, but they take a natural approach to things. I don't know if I'm not doing a great job. You want to add to that, Sean?
Well, yeah, no, you're doing a great job. So I think a naturopath just kind of, you've already answered the question a little bit. It's more of a functional approach, a whole body approach. So it's not just about prescribing a drug to treat a symptom. It's about why are those symptoms coming up? And if your diet can be changed, or if your rest can be changed, or if exercise can be changed, and you do need something to go along with that, then that's great. That's what a naturopathic approach is to me. And talk about, let's go ahead and define, you want to go ahead and define integrative approach?
So I guess the integrative approach in my definition is pulling from all areas of medicine, the allopathic, Western, approach of you need to use a medication to treat blood pressure, but then also going to the other Eastern medicine approach and not being afraid to look at like a Ayurvedic or Chinese herb, bringing in dietary. So it's really pulling in physical therapy, bringing in all the different modalities, I guess to say, in healthcare, and marrying them all together to try to treat the patient. And it, again, functional medicine or integrative medicine is really trying to integrate all areas from a wellness perspective. It's trying to keep people well versus, treating a sick person to get them better, I guess.
Yeah, that's great. So, and I think functional medicine is probably the newest of those terms. It just came out a few years ago, and we are actually having somebody that's just going to talk about functional medicine on our show in February. We're booking out guests in our show until February, so she's going to be on and talk more about functional medicine. But yeah, functional medicine is more about treating the problem, not just treating symptoms. And there are so many things that are related to so many disease states that we see today in our society, whether it be hypertension, high blood pressure, sleep apnea, depression, and even things from knee pain and hip pain. Those are things that many people find it hard to believe, but those things can be fixed with lifestyle changes. And rather than just treating it with surgery or a drug, functional medicine is going to go in and see what the root of the problem is and fix it from that route.
Absolutely. Okay.
So tell me a story. Do you work with a doctor that specifically works with functional medicine?
Actually, there are no currently, like if you look at the Institute for Functional Medicine, IFM, there isn't one in our valley. However, starting after the first of the year, there is a new physician coming in who is taking that approach, and we've already started to work with him. And it's really refreshing because the approach is all over the board as far as how he views patients, how he views treatments, how he views us as pharmacists as part of that triad. And I think that's huge because we have just a different lens that we add to that. So we're excited about it, and it's definitely different, and it's really exciting to see how his training is different in a very good way.
So I don't want to put you on the spot, but I'm going to put you on the spot. You haven't worked with anybody directly with functional medicine in Kalispell, but have you worked with somebody with functional medicine outside of Kalispell?
Yeah, we worked when I was exposed to functional medicine down in a provider down in Texas, and that's really where I learned about the topic. And then about 3 years ago, my wife, again, she's the early adopter of the two of us, and I swear she has that crystal ball vision. really started to learn about the functional medicine approach through that provider. And so that's what was attractive to us, because how could we bring our pharmacy and take that approach versus just move all the way to the holistic approach or all the way to the Western medicine, standard approach.
So do you have a story at all to share that how a functional medicine doctor helped one of your patients, get off a medication, a really expensive medication, or prevent surgery or something like that? Do you have a story like that?
In the year, I guess I do have one patient where this functional medicine doctor did. They diagnosed a Lyme's disease in this patient and was able to get them off of all their immune modulating agents that they were on that was suppressing the Lyme's, and actually treated the Lyme's with a treatment protocol to where now that patient isn't in a, like, they weren't ever in a wheelchair, but they used a walker everywhere they went, and now they're using like walking canes or walking sticks. So in the last 6 months since that, we have seen tremendous improvement with that patient. And that just speaks to seeing that provider look at that patient from a completely different view of, rather than treat the symptoms, let's get to the Lyme's and get it out. And with that, we've seen much better improvement with that patient.
That's a great story. We see those quite often, actually. I can think of one of the biggest stories I know of is a physician and he was actually a doctor himself, and he was working with a functional medicine doctor, and he was having GI symptoms, all kinds of like ulcerative colitis type issues, and a very expensive biotech drug was prescribed. It's like $4,000 a month. I can't even remember the name. I don't know if you know the name of that drug, Harley. I can't think of it off the top of my head.
Yeah, I can't either.
But it's really, really expensive, and it's also used to treat IBS. And of course, there's a lot of patients especially female patients, that are on this drug for quote unquote IBS, but not once has usually their physician that prescribes this really looked into the underlying issues and could it be diet related. So this guy worked with a functional medicine doctor and was able to get off that $4,000 a month drug and work on diet issues, and it actually fixed his problem. And that's what I like about functional medicine, is it's not just throwing a drug at the symptoms, it's actually fixing the problem. Another great story is headaches. How many times do you see a male or female, a lot of times it's female, especially if it follows their cycles, and they've been having headache issues for years and years and years, and it follows their cycles, and of course they've been to neurologists all over the state, including the University of Washington, and they've had all these special studies and CT scans and MRIs, and of course really they were lacking some type of hormone, a lot of times progesterone, and the progesterone can help their cyclical headaches. They don't need some fancy expensive drug. They don't need some expensive diagnostic test. Treat the root of the problem, not just the symptom. So, Harley, you said in the future, is there any other services that you want to offer at your pharmacy? You talked about some of them. Any new services that you can think of?
Yeah, I think an area that, to me, that's very interesting, that I'm passionate about, there's a couple areas, and one is men's health. I mean, I think women are exceptionally good at seeking care and starting to feel better, and us guys really, we don't do a good job of it, and we don't have to suffer, we don't have to drag as we get older. So I would love to start targeting men in many different areas for men's health, but that's one area. And then another area that I'm really interested in is food allergy. And, food allergies testing has been around for a while. I think it's come leaps and bounds. I'm still not sure where it all shakes out, but I think there's a lot of, like you kind of mentioned with that one patient, there's a lot of autoimmune issues that come from, because I see food as a medication as well, right? I mean, we need food to live, and I think that the American view of food is extremely warped, and I want to dig into into more and see how we can help more people, and that includes me, and my family. I've got 2 little boys that I need to model for, and I think that's a huge area that I would like to. We talk about it a lot. In every conversation that I have with our patients, we always talk about, what are you eating? What are you eating? What are you eating? And so that's a huge area that I'd like to look at as well.
Awesome. We'll finish that conversation up. Let's go to a quick break. You are on the air with Health Solutions with Sean and Janet Needham. We'll see you soon.
Our 13th district needs a state representative that has experience where it matters. Alex Ibarra has that technical and practical
Mr. Lopez.
expertise to be a strong voice in the legislature. Having worked on energy and water issues for decades, Alex believes we need to protect our farmland, promote our agriculture industry, and increase our family wage jobs. This November, your choice is clear for state representative. Please vote for Alex Ibarra November 5th.
It's advocate for that committee to elect Alex Ibarra for state representative.
Fall is a great time of year for golf at Moses Point. The course is in fantastic condition, and we're offering terrific deals on golf while the weather lasts. Thinking about a membership for 2020? Purchase now and pay the remainder of this year for free. And our very popular Green Fee Punch Card program is available for the remainder of 2019 with significant savings on the 10 punch card plus the newly introduced 5 punch card. Stop by the golf shop and find out more about great fall golf incentives at Moses Point, or give us a call at 764-2275 for more information. Moses Point, golf just got fun again.
We at Shiloh Inns are proud to be celebrating more than 44 years of providing you, our loyal customers, with Shiloh's sincere friendliness, efficient customer service, and clean, comfortable, attractive, non-smoking rooms and suites, all at an affordable price. Hello, I'm Mark M. Street, owner of Shiloh Inns. Our customers love our many free amenities, like free Wi-Fi and free continental breakfast, or hot, full, delicious breakfast at most Shiloh Inns, as well as our spas, steam, sauna rooms, exercise fitness facilities, and business centers. And at Shiloh Inns, even the kids stay free. And for you dog lovers, Shiloh is very dog friendly. If you ask your best friend where they want to stay, we think you'll get a paws up for Shiloh Inns. For reservations, call 800-222-2244 or visit our website at shilohinns.com. Shiloh Inns, affordable excellence. American family owned and proud of it.
You're listening to the Columbia Basin's first choice for news and information. AM 1470 KBSN Moses.
Welcome back, listeners. This is Sean Needham with Health Solutions with Sean and Janet Needham. Listen to us here every Monday, 1 to 2 p.m. We have Harley Brotherton on the line still, and we will be finishing up with him shortly. Harley, you mentioned, men's health, and I think that's something that can get overlooked sometimes. I think we're so used to treating the women's hormones, and I know one of the best ways to get men in to see their doctor or get their hormones balanced is to get their wives feeling better first.
Yeah, absolutely. Because they see the progress that their wives make, and they're like, well, maybe there's something to this, and I can be better as well. So.
And another thing you mentioned too, and I believe in it wholeheartedly, is that as parents, we need to be good role models for our children, and so exercise and eating is so important in what they see from us, because they will instill lifelong habits from us.
Absolutely.
So Harley, so how can people get a hold of you?
Well, a couple ways. You can call me. We still have a phone number. We're area code 406-257-2083. That gets you right to the pharmacist. You can visit our website at myevergreenrx.com. We have a Facebook page, and we do a lot of, we haven't done a lot, but that's a huge goal for us is my wife actually worked with a functional medicine doctor out of Ohio, and they did some thyroid and customized women's education Facebook Lives on there. So, and all that is free. Again, we're passionate about the education. So, and of course, you can come in and see us. We're 2640 U.S. Highway 2 East in Kalispell, Montana, on the way out to the airport. Easy to get in and out, and come see us anytime. We'd love to see you and meet you.
Awesome, Harley. It was nice chatting with you. Thank you so much for being on our show. There's another episode, folks, with Health Solutions with Sean and Janet Needham. We will talk to you next Monday.
Before the next round arrives tomorrow, when firefighters will be tested again.
Isabella Stone on the fire line in Windsor.